This vaccine equity video series is produced by the Public Health Alliance of Southern California. Our series elevates promising and replicable practices for equitable vaccine distribution. Practices happening both here in California and across the nation. Our video series will showcase community-informed and equity-centered practices that specifically aim to reach disproportionately impacted low-income communities and communities of color. My name is Marley Williams, and I am the Health Equity and Justice Manager here at the Public Health Alliance of Southern California.
And I'm Dana Sherrod, Birth Equity and Racial Justice Manager for the Alliance. The Public Health Alliance of Southern California is a coalition of the 10 health departments here in Southern California. Collectively, our members represent 60% of California's population. In this video, we speak with Hugh Nguyen, Director of the Orange County Healthcare Agency, Office of Population Health and Equity, and Chloe Rios, CEO and founder of Alianza Translatinx, the first transgender people of color-led organization in Orange County. Their mission is to protect, defend, and advocate for the needs and rights of the transgender Latinx community and other disproportionately impacted communities. Hugh and Chloe discuss their partnership efforts to reach transgender and gender nonconforming residents in vaccine distribution and administration through the creation of safe, inclusive, affirming spaces for transgender residents of Orange County.
Can you tell us a little bit more about the particular partnership effort, the mobile clinic effort that you all just hosted this past week? And what were some of the critical steps that the health department took to make this effort a success?
So for the healthcare agency, some of the efforts that we took in order to make this effort a success was one, really first to really understand the needs of the trans community and what are some of the barriers that the communities are facing with regards to COVID vaccine. Second, really making sure that we also engage other LGBTQ serving organizations in the conversation as well. So it was a collaborative approach. And then I think for me, third is it's really making sure that the collaborative was co-led by trans leaders and trans specific organization. So that's why we worked with Chloe and Alianza to make sure that they were co-leading the effort rather than just a partnership with the county.
And Chloe, for Alianza, what were some of the steps that you all took to ensure that this mobile clinic effort was a success? What were the different steps you had to take to ensure that folks were able to register, feel safe and supported during the event? And how do you hope to build on this success moving forward?
Yeah, that's an amazing question. And I'm just going to tell you that in Orange County, the transgender community has felt that we've been ignored. And so one of the steps that we took was to make sure that we outreach to these communities who have often been left out and who do not feel that they're a part of the healthcare system in the county. And how we did that is we went out to the streets at night. We performed community outreach to really invite people of our community, like I mentioned before, specifically the sex working community. And we really established that relationship with them and let them know the importance of getting vaccinated. We also took other steps to outreach to our community. We use social media. Social media is huge in our community. And we noticed that the majority of our community use Facebook, for example, to be able to communicate with each other. And so to us, it was really important to take that step and build those relationships with our community through social media and communicate with them about the importance of coming in to get their vaccine. And our community is also once we hear that one member of our community is getting the vaccine, they automatically tell their friends and their family members. And so really word of mouth was also the way that we approached our community. I think overall, it was just the collaboration between the county and Alianza Translatinx that made this possible. But because we are an organization that is led by transgender people for transgender people, the community really identified with our work and with us. And that was really the real reason why the community trusted in this collaboration and why we had so many people coming in to get their vaccine that day.
And really for us as a health agency, working in partnerships and having communications with Chloe, really reassessing our whole process from the point of registration and what information we collect, making sure that it was trans affirmative. So not just asking people legal name or assigned name at birth, but also their chosen and preferred names. Also including areas like sex assigned at birth and gender identity. So that's sort of the registration process. And then at the point of vaccination, we made sure that everybody was had some sensitivity and awareness training. We also had name tags for folks that came and also had gender pronouns underneath their name tags to make sure that the staff and the volunteers are addressing people by their chosen name and their pronouns, rather than what's on their ID and whatnot. And then we also, in the observation area, we had trans flags, LGBTQ flags, really just to try to create that safe space. I know that as a queer person, going in any spaces, I see a trans flag or an the LGBTQ flag, it makes me resonate, and it creates a safer space feeling for me. And so we were very, thoughtful and mindful about creating every step of the way, creating that sense of safety for the community.
That's really good, Hugh. And something that I just wanted to ask as a follow-up to that is you talked about some sensitivity training for staff who were going to be on site. And can you just talk also a little bit about what that looked like?
So prior to the event, I just sent out a 2-slide PowerPoint presentation, one with the genderbread person explaining the difference between sexual orientation, gender identity, sex assigned at birth, etc. And then the second slide was an acronym that spells out trans care and some of the steps that people can take to make sure that we're creating a trans affirmative environment. Secondly, we also kind of just, to our vaccinator, the clinical staff and the volunteer staff, we kind of just made it known that anybody who might have certain feeling about trans folks, gender nonconforming folks, not to volunteer, not to work on the day of. So they have to, attest to that. And then I think thirdly, day of, and Chloe can talk about this because Chloe was the one to do some day of reminder and training for folks. And I know that was very impactful. So Chloe can speak to that.
When I arrived to the day of the event and I was able to address all of the volunteers, I remember that it was very, it was like everyone had already been explained every little detail that was gonna happen, and it was very easy. I saw the responsiveness of the volunteers, and I'm, to this day, I still hear comments from the people that attended the event to get vaccinated, how amazing all the volunteers were, and that they felt so comfortable. And so I just want to make sure that I acknowledge that, because Hugh, and that I gave you a long list of things that I told you I don't want this to happen, and you made it happen. And I just think that this is the reason why we wanted to do it this way, and why we had such an amazing and successful event. It's because of the training that happened prior to the event, and to make sure that the community felt included and just, felt comfortable throughout the vaccination process. As far as the data collection, I know Hugh can speak more about it, but I believe that we had over 250 people from the transgender and gender nonconforming community obtain their vaccine that day. And so really it was a very successful event.
Why is it important and urgent? And you've sort of spoken to this a little already, but I'd love to just ask you this question directly. Can you explain why it's important and there's urgency for health departments and other local jurisdictions to really support specific vaccine distribution efforts aimed at reaching the transgender and gender nonconforming community, and specifically residents of transgender and gender nonconforming residents of color?
Yeah, as I mentioned earlier, I think that because of all the barriers that we encounter as transgender people and people of color, there's a huge hesitation. There's also a huge lack of education within our community, and there's a lot of misconceptions about vaccines, right? Just in general. But then when you introduce something new as a COVID vaccine that was delivered to us in such a short time span, I think community is really scared. And so it is very important for us to eliminate those misconceptions, and very important for people to understand that in order to reach immunity herd, we need to all participate and get vaccinated. And so that's really the importance of making sure that the transgender community gets involved, and that if we want to have a world that is back to normal, we all have to put a little bit to make sure that happens. And so honestly, that's the reason why we believe that it was crucial for the county to perform or to put together, along with Alianza Translatinx, a community vaccine that was specifically for the transgender community, so that we could all just have the comfort of going somewhere that we know we're going to be treated with dignity, and that we're going to have the ability to get equitable health access. And so that's really why we wanted to make this a reality. And so I'm just glad that it happened, and that the community now talks about it, and they're very happy with getting their vaccine at that specific site.
I would just like to add that I think we're not just dealing with hesitancy in communities of color, trans community of color, but also we're dealing with a lot of institutional mistrust. I think the healthcare system has not been kind, have not been just to the trans community, especially trans people of color. And so when we think about vaccine equity and how do we address the inequities that exist, we have to make sure that we work with community-based organizations that are, in this effort, trans-led, right, trans-specific, so that we could mitigate some of those mistrusts, or at least begin to mitigate some of this mistrust, and for the purpose of vaccination effort, but more importantly, to build that relationship with the community in the long run, right? So that we can sustain that collaboration, sustain the efforts around health equity, addressing health disparities in the trans community, and especially the trans of color community.